dramatic increase, 70 would have still represented only about 11% of all eligible tribes. You also mentioned that tribes have to compete against one another for grants, while states get mandatory funding. Can you talk about the challenges tribes face when competing for funding? How would tribal home visiting programs and the families they serve be impacted?
Welcome back to Freedom Forge, the channel where we stand for faith, freedom, strong families, limited government, and the constitutional values that made America the greatest nation on earth. If you believe government should be accountable to taxpayers, that families, not bureaucracies, should be at the center of public policy, and that Washington must prove every tax dollar is being spent wisely, make sure you hit that like button, subscribe to Freedom Forge, and turn on notifications so you never miss our in-depth coverage of the biggest congressional hearings and political debates shaping America's future. Today's congressional hearing focused on the maternal, infant, and early childhood home visiting program, commonly known as MIECHV. Members of Congress heard testimony from experts, community leaders, and program administrators about federal funding for home visiting services, workforce shortages, tribal grants, and whether these programs are effectively serving children and families across the United States. The hearing centered on whether Congress should expand funding and how these programs can better support parents while reaching underserved communities, particularly Native American and Alaska Native tribes.
I had to do that for you, brother.
Thank you, Mr. Carey. I will now turn to Ms. Chu of California.
Well, I want to thank all of the witnesses for sharing your experiences and doing such a great job at it. The evidence could not be clearer that home visiting delivers such strong, positive outcomes for children and families. 4 years ago, I was proud that this committee worked in a bipartisan manner to pass a MIECHV reauthorization bill named after our incredible colleague, Jackie Walorski. In that law, we doubled overall MIECHV funding and also doubled the set-aside for tribal home visiting. As a result, Ms. Sinas, you testified that by the end of 2027, we expect it to have as many as 70 tribes receive MIECHV grants, which is about triple the number that we had in 2022. But even with that dramatic increase, 70 would have still represented only about 11% of all eligible tribes. You also mentioned that tribes have to compete against one another for grants, while states get mandatory funding. Can you talk about the challenges tribes face when competing for funding? How would tribal home visiting programs and the families they serve be impacted if Congress were to increase funding for tribal MIECHV so that tribes don't have to compete for such limited funds?
Thank you for that question. There are challenges in competing for the funds, and because of the high competitiveness of these grants, it can provide some challenges. Oftentimes, tribes are being operated by small administrative staff, where a single employee may, like myself, wear different hats. So there are administrative and capacity constraints when applying for a highly competitive federal grant. Also, some tribes may not know that the evidence-based models that are here today are being able to be adapted. And so oftentimes, while these models are important, they have not been evaluated or validated in some American Indian and Alaska Native communities. So being able to look at those adaptations are important when a tribe is applying for funding. So shifting the competitive scarcity of funding, shifting it to more equitable, sustainable funding that respects tribal sovereignty and fulfills the responsibility for ensuring that Native American children do receive the home visiting supports that they need. Expanding the funding for home visiting would definitely increase the services in tribal communities, especially in Alaska Native villages where they have to, they can't get to homes without, boat flight or, and so it would definitely increase the number of families being served in tribal communities. Thank you for that question.
Thank you. And I'd like to address this question to both Ms. Longoria and Dr. Sinas. And it's about the fact that there's a big challenge that we've heard about recruitment and retention for the workforce due to issues like low pay and overwhelming caseloads. So, Ms. Longoria, you were a former home visitor, now supervisor. What challenges do you see with those issues? And Dr. Sinas, can you talk about the unique challenges that tribal MIECHV programs face in hiring and retaining home visitors?
Thank you for that question. I can tell you reflective supervision provides an immense support to our home visitors, which is a integrated part of the PAT model. It provides them a safe space to feel supported, heard, and reflect, and be able to reflect, which is what they provide to families. So thank you for asking about the investments we need. I spent time maneuvering budgets and making decisions for our staff and resources every day. My first recommendation is to do all you can to increase MIECHV funding. I mentioned it in my written testimony, we struggle to pay parent educators what they are really worth. Yeah. We are having a difficulty hiring for our vacant parent educator position as applicants are declining due to low salary.
Yeah, sorry, I want to make sure that Dr. Sinas has a chance to respond to.
Thank you for that question. Our home visitors are members of tribal communities, so oftentimes they're approached at grocery stores and other functions, and so they're never off the clock. So this may mean also burnout when they have to serve their communities. So reflective supervision does provide a lot of that support. In addition, we pay is another example of what we are challenged with. And finally, to find professionals with qualifications and the deep cultural and language backgrounds, it is necessary to increase the pay and really support these home visitors through reflective supervision. Thank you for that question.
Now, this hearing was interesting because unlike many of the explosive confrontations we've seen on Capitol Hill lately, today's discussion was more policy-focused than political theater. But don't let that fool you. Beneath this calm discussion lies a much larger debate about the role of the federal government, taxpayer spending, and who should ultimately be responsible for strengthening American families. Representative Judy Chu opened her remarks by praising the witnesses and emphasizing what she believes is overwhelming evidence that home visiting programs improve outcomes for parents and children. She pointed to bipartisan legislation that increased funding for these programs and specifically highlighted additional funding for tribal communities. Now, whenever I hear Washington talking about increasing funding, my first question is always the same. Where's the accountability? Notice how quickly many politicians jump to the conclusion that if a program faces challenges, the answer is simply to spend more money. That's become the default solution in Washington. Need better health care? Spend more. Need better education? Spend more. Need better housing? Spend more. Need stronger communities? Spend more. But conservatives have learned through decades of experience that spending more money doesn't automatically solve problems. In fact, America has spent trillions of taxpayer dollars over the years on countless federal programs. Yet many of the same social problems continue to grow. That doesn't necessarily mean every program fails. It means taxpayers deserve proof before Congress writes another check. One witness argued that tribal communities struggle because they compete against one another for grants while states receive mandatory funding. She explained that many tribes have very small administrative staffs and often lack the personnel needed to complete complex federal grant applications. Now that's actually an important point. Government bureaucracy often creates obstacles that Washington itself created. Instead of making programs easier to access, federal agencies often bury local organizations under mountains of paperwork, compliance requirements, reporting standards, and lengthy applications. Conservatives have criticized this for years. If the federal government insists on creating these programs, then it should at least make them efficient. Every hour a community leader spends filling out paperwork is an hour they aren't spending helping families. Another issue discussed was adapting evidence-based models for Native American communities. The witness explained that many existing models have not been fully evaluated within tribal communities and that programs should be flexible enough to respect tribal sovereignty and local traditions. Now, regardless of political affiliation, I think most Americans can agree that local communities understand their own needs better than federal bureaucrats sitting hundreds or even thousands of miles away in Washington. That's one of the central principles conservatives have always defended. Local control, federalism, decision-making that happens closer to the people being served. Washington cannot possibly understand every challenge facing a rural village in Alaska, a farming community in the Midwest, or an inner-city neighborhood in Ohio. Different communities require different solutions. That's common sense. Representative Chu also asked about workforce shortages. Several witnesses explained that home visitors often experience burnout because of heavy workloads and relatively low pay. One supervisor admitted they struggle to recruit new employees because qualified applicants decline positions due to salaries that simply aren't competitive. Now here's where conservatives should ask another important question. Is the problem really funding? Or is the problem how existing funding is being managed? Before Congress approves billions of additional taxpayer dollars, lawmakers should examine where the current money is going. How much reaches frontline workers? How much gets absorbed by administration? How much disappears into bureaucracy? How much is spent on compliance rather than direct services? Those questions matter, because every dollar Congress spends belongs to hardworking Americans. It belongs to the small business owner trying to meet payroll, the truck driver spending long hours away from family, the construction worker paying higher grocery prices, the police officer working overtime, the farmer dealing with rising equipment costs. Taxpayer money isn't free money. Someone earned every single dollar. One witness also explained that tribal home visitors are often members of the communities they serve. That means they're never really off duty. People approach them at grocery stores, community events, and family gatherings because they're trusted members of the community. Honestly, that's understandable. We are deeply involved in helping families. Those relationships don't suddenly stop when the workday ends. But again, Congress needs to ask what solutions actually address burnout. Is the answer simply hiring more federal employees? Or is it giving local organizations greater flexibility to manage workloads according to their own communities? Sometimes Washington assumes bigger government automatically produces better results. History tells us otherwise. One phrase kept coming up during this hearing: reflective supervision. The witnesses described it as giving workers a safe environment to discuss difficult situations, receive emotional support, and improve their effectiveness. Supporting employees is certainly important. Burnout affects every profession. Teachers face it. Police officers face it. Healthcare workers face it. Military personnel face it. But we also have to recognize something else. America's strongest support systems have traditionally come from families, churches, neighbors, and local communities, not federal agencies. Government programs should strengthen those institutions, not replace them. One thing I appreciated about this hearing was that there wasn't much partisan fighting. The discussion focused on practical issues instead of campaign slogans. That's refreshing. Congress can actually accomplish meaningful oversight when lawmakers ask serious questions instead of trying to create viral moments. Unfortunately, that's becoming increasingly rare. Still, there are several questions I wish someone had asked. What measurable outcomes justify additional funding? How many families become financially independent after participating? How many children show long-term educational improvements? What percentage of funding actually reaches families versus administrative costs? Which programs perform best? Which programs consistently underperform? Are there annual audits available to taxpayers? Those are the questions conservatives should continue asking. Because accountability isn't opposition. Accountability is responsible government. If a program genuinely helps families become stronger, healthier, more educated, and more self-sufficient, then taxpayers deserve to know exactly why it's succeeding. Likewise, if certain programs fail to produce measurable improvements, Congress should have the courage to reform them rather than automatically increasing budgets year after year. At Freedom Forge, We believe strong families are the foundation of a strong nation. Children thrive when parents have opportunities. Communities thrive when local organizations are empowered. America thrives when government remains accountable to the people who fund it. That's why these hearings matter. They're not simply about one program. They're about determining what role Washington should play in American life. Should every challenge result in another federal program? Or should Congress focus on creating an economy where families can succeed through good jobs, affordable living, strong local institutions, and responsible governance? That's the bigger conversation. Listening to today's hearing, I think there's room for agreement across the political spectrum. Most Americans want healthy children. Most Americans want stronger families. Most Americans want communities to succeed. The disagreement isn't usually about the goal. It's about the method. Conservatives generally believe lasting success comes from personal responsibility, economic opportunity, strong families, faith-based organizations, local leadership, and limited but effective government. Progressives often believe expanding federal programs provides the best path forward. Reasonable people can debate those differences, but everyone should agree that taxpayer dollars deserve transparency, accountability, and measurable results. If Washington continues investing in programs like these, Americans deserve clear evidence that those investments are improving lives, strengthening families, and creating independence rather than dependence. At the end of the day, no federal program can replace strong parents. No government grant can replace loving families. No bureaucracy can replace local communities that truly know the people they serve. Government can assist. It can support. It can provide opportunities. But America's strength has always come from its people, not from Washington. That is a lesson every member of Congress should remember as these funding debates continue. Now I'd like to hear from you. Do you believe Congress should continue expanding federal home visiting programs? Or should more responsibility and funding be shifted to states, local communities, churches, charities, and private organizations that are closer to the families they serve? Share your thoughts in the comments below. We read every one of them, and your perspective helps keep these conversations going. If you enjoyed this analysis, don't forget to like this video, subscribe to Freedom Forge, and share it with someone who believes in freedom, accountability, constitutional government, and strong American families. Thanks for watching, and we'll see you in the next video.